Welcome everyone to the Public Health Improvement webinar. I'm your host, Liliana Johnson with the National Network of Public Health Institutes, or NNPHI for short, welcoming you to Kentucky's Accreditation and QI Support from Within, with accreditation coordinators from two different local Kentucky health departments. First, we'll hear from Alan Kalos from the Northern Kentucky District Health Department, and then from April Harris from Three Rivers District Health Department. I'm sure many of you are familiar with these fine practitioners. And without further ado, let me turn it to Alan.
Yeah.
Great.
Yes, technology is actually working. I am amazed. This is the first time I've used this technology, so bear with me. I'm going to start and give you some of the background about how we got started and a little bit of history, a little bit about Kentucky. As Juliana said, April Harris and myself, I'm Alan Kalos, will be talking about what we've been doing in Kentucky for the last decade or so. I'll start with a little background of Kentucky. This is a map of the state. We border on the north, Ohio, Indiana, Illinois, Tennessee on the south, and run from the Appalachian Mountains to the Mississippi River. We're noted for a lot of parks and beautiful country. We grow a lot of tobacco here. Unfortunately, we smoke too much of it. We also have the beautiful bluegrass region, which is great for raising racehorses. And we're home to the original Colonel Sanders Kentucky Fried Chicken, again of which we eat too much of, and wash that down with some nice smooth Kentucky bourbon. So that's a little background to who we are in Kentucky, and a little bit about the map that's up on the screen right now. Hopefully you all can see that. And you'll see there are 120 counties in Kentucky. The ones in white have individual county health departments. Those that are colored are district health departments that cover many counties. Let me see if I can get this arrow to work. Yes. The green up here at the top, this is Northern Kentucky District, where I'm from. And the yellow here and also over here in Pendleton County is Three Rivers District Health Department, which is April's home district. Those that are outlined in the dark outline, those are the 6 health departments that are currently accredited health departments. I'll move from there to a little bit of our background and history of who we are and what we've been doing. And if you kind of bear with me, some of you know some of this history and maybe some of you don't. The whole concept of accreditation started back in 2001 with the Institute of Medicine's report that said maybe local health departments ought to be accredited. From there was a group of experts from around the country that got together. There was ASTO and NALBO and NACHO and what was the other one? APHA brought together a group that looked at the idea of putting together a national voluntary accreditation program. About the time that they issued their report in 2006, Dr. Stephanie Bailey, who was chairing one of the Exploring Accreditation committees, came to a CADA meeting. CADA is the Kentucky Health Departments Association, which is the Kentucky NATE-SHO affiliate, and presented this concept of accreditation to the CADA group. This was talked about for a couple of years. In 2007, CADA formed a committee to look at accreditation. And about the same time, from 2008 to 2011, PHAB was put together and started forming committees, and a part of that, several people from Kentucky were members of some of those committees. We took part in the alpha test of the standards and measures. Franklin County was also one of the beta sites. If you go back to the map here, Franklin County, which is also our capital, Frankfort, was a beta test site. So we've been involved for quite some time in the various processes of pulling accreditation together. In 2010, CADA had a strategic planning retreat at the Barren River State Park. At that time, they asked then graduate student Angela Carmen to develop a readiness survey of local health departments during a strategic planning retreat. And April's going to talk about that a little bit more a little later on. Also at that retreat was the idea of pulling together an Accreditation Coordinators Workgroup, and they had their first meeting there. Following that, in 2011, back in January, was kind of the first formal meeting of the Accreditation Workgroup, and we have been meeting as a work group pretty much monthly, although we've skipped a few months here and there since then. The picture you see on the screen here in December 2011, this was a Kentucky contingency at the first PHAB training for accreditation coordinators. Dr. Kay Bender in the center here. I'm over here. That's me, and then April, so you know who we are. And so this was at our first training. Later on that year, after we'd been meeting for several months, we held our first retreat of the accreditation coordinators in October 2011. We've been, every year, we've been holding a 2-day retreat, which is in conjunction with the CADA annual retreat in Kentucky. And if you notice the trees in the background, that's because we hold our meetings, the retreat meetings, at our Kentucky state parks, of which we get a break as far as what it costs to hold, to travel, and they have conference centers at these state parks. So we try to hold our meetings when possible. And also there's a good dozen or so of these state parks around Kentucky. So we move the meeting every year, in the north, south, east, west. You just saw from the map, Kentucky isn't very far north-south, but going east-west, travel can be an issue. Let me move on forward. So we've been holding, like I said, regular meetings for about the last 4 years or so, and an annual retreat. Our monthly meetings, we try to hold them face-to-face meetings, but as I said, travel over distances can be a challenge. So we also have ITV, or interactive television in place of the face-to-face for those who can't make the meetings. So we have about half that will attend the meetings in person and about half attend by the closed-circuit television. We keep in touch. We have a listserv where everybody in all the health departments and accreditation coordinators are linked into the listserv. We have a file sharing system that we've been using. And we've been doing things like mock reviews and QI and Jumpstart. And April's going to talk a little bit more about these later on in the program. At our annual retreat, this is a 2-day retreat. We've had 4 of them. And the agenda is fairly similar for those. We have a show and tell time where we get and talk about what each health department is doing, where we are at in the process, whether we're just starting the process. Some of us are accredited and working on doing our annual reports. Some are in the planning phase. And we look at what are we going to do for the next year, and we start talking about what are some of the themes that we want to cover. There's always some time that's put for discussion of the different domains. And then we have various presentations, and those are like QI and performance management, the CHIP and strategic plans, which are the prerequisites. And we use mostly talent from within our own state. We have some that are very talented in these different areas. And not only are these local health departments, but our state health department, University of Kentucky, are all involved in our accreditation work group and attend the meetings. And we do a lot of team building kinds of exercises as well. At our monthly meetings, we have usually a guest speaker that will come in and talk about a topic. And again, our guest speaker comes from our talent pool within Kentucky. For the most part, we're not paying people to come in from other places. We look at documentation questions as standing agenda items. We look at documentation questions, and those of us who are more advanced through the process answer some of those questions. Others that are looking at it have answers that we don't. We also try to do something along the lines of quality improvement and performance management, because that really, from the very beginning, and the PHAB group has also really stressed the concept that this whole accreditation concept is built around quality improvement and performance management. And we also try to hold some team building exercises where we work together to try and keep the group cohesive. Consistent with the PHAB standards, we make sure we have agendas at every meeting, and we follow those up with minutes. We talk about the different what's going on and with NACHO and other things that are going on. We have some time spent for various local health departments to bring in what they've been working on and some of the things that where they have expertise. And then finally, we also look at, well, what are we going to do at the next meeting? And we develop some priorities for the next meeting. We decide, who would be best to present the major topic at the next meeting, who will facilitate, who will take notes, and all of those kinds of housekeeping kinds of things. And you notice down the bottom of the agenda, we also have like what's going to be the call-in number and our IT number for if you are going to be calling in. Our indicators of success, like I said, we've been at this for a while, for 4 years. We think that's an indicator that we have something going that's pretty good. We have 6 accredited health departments in Kentucky and several more that are well into the process at this point. We have continuing membership, and for our meetings, at least 50% of our local health departments and also our state health department, and I said our local universities, we've had some continuing attendance from those as well. So we've had really good attendance. We share the reasons that we think that we've been very successful is that we've had a long history of sharing information about what's going on in public health through our CADA, through our KPHA, through our sanitarians group that meet, and we have, a lot of the organizations throughout Kentucky meet on a regular basis that are involved in public health. And then finally,
hey, Alan, this is Lil. Do you mind just speaking a little bit louder? We just got one request.
Okay. Well, I'm trying to look at the screen and talk too, and my phone and the screen are in 2 different places, so forgive me. And besides, I'm going to turn this over to April in just a second here. But one of the things that has really kept us together, a lot of our meetings have been in Frankfort or near Frankfort, which is very centrally located in the state and accessible by most of our health departments. And those that can't make it, we do have the interactive television connections. So some of the things that have lessons learned, and these are some of the challenges that we've faced, and that's things like changing leadership. We have not had like one person leading the group all of the time. We've moved that leadership around. The state health department has taken some of the leadership. UK has taken, like I said, Dr. Angie Carmen led some of the meetings, and local health departments have led some of those meetings. The other challenge, as I mentioned earlier, is the large geographic and challenges we've had, especially with far eastern and far western Kentucky, and keeping things relevant so that the issues that we have are not being redundant, but also we're keeping those various segments that are just starting the process and those who maybe have been in the process a long time. I'm going to ask April if she can jump in at this point and maybe talk about some of these lessons learned from her perspective, because she's been involved in some of the stuff that I haven't. So April, can you pick this up?
Sure. Good afternoon. I'd also like to touch on one indicator for success that we failed to include, and that is that 4 accreditation coordinators in Kentucky have received jobs as the public health director. So it's very obvious that the accreditation experience is valued here in Kentucky, and we're really grateful that we've had leadership that has valued accreditation here. Going back to some of the lessons learned, when NIFI funding was secured for our state Department for Public Health assumed the responsibility of our Accreditation Coordinators Workgroup. Looking back, the work group met more often and had more communication and generally functioned more effectively when the local health department employees had control of the group. So that's something that we know that the effort started locally, and we know that that is when it thrives, when our local health department accreditation coordinators are taking the lead on that. So just for reference, in the beginning we met every month in person and through the ITV, and then when our State Department for Public Health took ownership, we met not even quarterly. And so now we're trying to amp things back up and get on the right track and meet monthly and rotate, some months meeting face-to-face and some months meeting ITV. As Alan said, we do have a very large geographic area. Kentucky is almost 400 miles long, so finding a central location can be difficult. So we do utilize the ITV, but that isn't always reliable. So we are trying to keep that in perspective when we're planning our meetings so that we can have more participation, especially from our western and eastern Kentucky counterparts. We have health departments that are in the very early stages of planning for accreditation and those working on reaccreditation, so keeping meeting topics relevant to all members of the group can be a challenge. We also have accreditation coordinators that have been active since our work group's inception, and then accreditation coordinators that have joined brand new to the position within the past several weeks. So we have a wide array of experience in our group, as well as a continuum of progress towards accreditation, which is one reason why it's really important to do some sort of an annual meeting focused on determining what's important for us to be meeting about. What types of trainings do we need? What are our biggest challenges? And that's what we try to accomplish every year at our annual retreat. For us, we've never utilized any funding for our group. All of the travel to and from meetings and our time is paid for by the respective health departments. With the state's NIFI funding, we did have 2 quality improvement trainings that were held, but these weren't exclusive to the Accreditation Coordinator Workgroup members. Up until this point, we've had no money, and I'm very excited to say that we have received a little bit of money, and I'll go into that in just a few slides. With that said, there are several entities that we've tried to apply for grant funding for and resources in the past. So looking back, I would have engaged funders earlier in our process. So we wanted to highlight several projects that we've tackled over the years, starting with a model for assisting other health departments with documentation reviews. The first one was in January 2012, and since then at least 6 others have been completed in various formats, with the basic premise to bring in other accreditation coordinators or subject matter experts for 1 to 2 days and review documentations as if we were PHAB site visitors and provide feedback prior to submitting the documentation to PHAB. And in Kentucky, we have many trained site visitors from PHAB. So we always do a disclaimer that we are not representing PHAB when we're looking at the documentation. We're just representing April Harris or Alan Kalos. And this is just my team that I used for the mock documentation visit. I had 6 internal Three Rivers employees, and then my external team included 2 employees from our state health department and 3 other accreditation coordinators from the work group, and then 1 preparedness coordinator that does a really, really good job. And that was one area that I was a little bit worried about with our documentation, so I wanted to pull in a subject matter expert for that. Here is just an example of the review form that was completed for each piece of documentation that was potentially be submitted to PHAB. The score is consistent to PHAB scale, and I gave ample room for comments on how it could be strengthened or improved. And at the completion of this review, I had an idea of what was ready to be submitted, what needed minor tweaks, and what should be entirely revised. I also surveyed the group at the end to see if this experience helped them, and all respondents said that it helped understand the process, the standards and measures, the interpretation of documentation. So there was a lot of perceived value in this from all participants. And then from my standpoint, this was probably the most valuable preparation activity that I did preparing for our submit to PHAB. So we've done 2 surveys to assess accreditation readiness with all of our health departments. The first one was done by Dr. Carmen that Alan mentioned while she was working on her practicum for her doctorate. These were specifically looking at PHAB prerequisites and identifying what stages of process you're in. So here's a look at the 2013 survey when asked about a community health assessment and where you were in your process. And this was sent to local health department directors and accreditation coordinators across the state. And then this is similar to the last question about assessments, and this one is specific to the Community Health Improvement Plan. We try to get the survey completed about every 2 years, so we're almost to the point to complete our next one and potentially look at the comparison data to see if our numbers have changed. So this is a map of Kentucky, and it depicts the 61 health departments across the state and their self-reported accreditation status, as well as their plan for accreditation, broken down into increments. So if they are accredited, if they've submitted their application, if they plan to apply within the next year, the next 2 years, or within the next 5 years. The white ones either did not respond to the survey or do not plan to apply. And again, this was sent to the health department directors and accreditation coordinators. So we've had one more health department achieve accreditation status since this has been updated, and that's Barren River, the Green Health Department. We wanted to touch on involving your state health department. As you heard me mention earlier, for the most part, our state health department has always participated in our work group in various capacities. And Alan and I wanted to highlight a few ways they can be involved. So most importantly, if there's any overlapping documentation that they can provide, like any laws or plans or policies that all health departments in the state adhere to. So for us, there were certain regs dealing with our Board of Health or our governing entity that every health department in Kentucky could utilize. And then for their subject matter expertise, a lot of them work exclusively in program areas like preparedness or health equity that could come to our monthly meetings or share what they're doing in that particular program. As I mentioned, I had 2 state health department employees come to the documentation review, and that was just a second set of eyes that could look at all of the documentation and also help them get their wheels going for their own accreditation process. And most importantly, to promote accreditation, accreditation needs cheerleaders so they can help spread the message. In Kentucky, our commissioner recognizes accredited health departments at our annual conference each spring, and so the state has really been a good resource when needs are identified. So they have sponsored a cultural competency training, and they're working on a statewide map training. So when we collectively have a weakness or a challenge, I do feel confident that our state health department can hear us out and see if they have any resources that could help the health departments across the state. So we're growing, and that's exciting. To touch on the funding that we've received, in 2012, NNPHI supported the development of the Kentucky Population Health Institute, and this summer they received money from the Foundation for a Healthy Kentucky for several projects, and one of the funded objectives was continued peer networking specific to accreditation through the Accreditation Coordinators Workgroup. Because we've never had money, we're still scratching our heads on how exactly we want to spend it, but we have some great ideas that will probably involve bringing in some accreditation and quality improvement experts from other parts of the country. So we will be working on that, and we're really confident that we will achieve more funding based on the results that we initially get from that. Then the Accreditation Jumpstart team, this is an idea from Dr. Carmen at UK and has evolved with some of mine and Alan's input as well as others in the work group. The thought being, what about the health departments that don't know where to begin or have less than 10 employees? So this team would essentially almost be like the energy drink behind an accreditation effort at a health department. We could assess their strengths and opportunities, provide technical assistance or consultation on the entire process or just pieces of the process. We could provide documentation reviews, answer interpretation questions, and kind of scale up or scale down depending on their needs. So we have 2 very interested health departments that we know of, and we are ironing out those details so that we can get that started. So I found that it's really easy to automatically jump to the reasons why something won't work. So this will help shed some light as to how this collective effort can work. So I don't have a group as big as yours. Well, we've had meetings consist of 5 to 7 people and then some as big as 30 people. So start with who's interested, but don't concern yourself with reaching every single accreditation coordinator in your state, because we still have health departments in Kentucky that have not appointed an accreditation coordinator. So don't worry about the size. Just go with who's interested. We don't have accreditation or quality improvement experts in our state, and I wouldn't say that we call ourselves experts by any means, but I do know that our group is really excited and willing to learn together, and I think that that's been our biggest key to success, is that we learn together and we share with what we know. So don't feel like you have to bring in experts to make your group have good outcomes. We don't have any money. Well, as I touched on, there has been no money with the exception of scattered travel here and there. So it can be low cost. And then not knowing where to start, begin thinking about who can come to the table and what they can bring. And don't limit yourself to just health departments that are really invested in the accreditation process, because just because a health department isn't almost ready to submit their documentation doesn't mean they don't have really good policies or plans that they could still share. And I always try to start when I'm thinking about QI projects, what isn't going as well as it could be, and get the conversation going in that direction. And that would be a good place to start in the beginning with a group like that is, what are our biggest challenges, or what can be better in this process in terms of our documentation needs or just overall process questions. So here is our contact information. If you ever run into a question, we'd always welcome you to reach out to us. And if we don't know, we can ask our Accreditation Coordinator Workgroup members, because like Alan said, we have a listserv, and it was just Friday we got an email that said, hey, what are your thoughts about this measure? So we are always in constant communication with each other, trying to help each other out. And some of our Accreditation Coordinator Workgroup members are on the call today, so as we enter into questions, I'd encourage them to chime in if they had some feedback as well. So at this point, we'll take questions or comments, and Lil will get that going for us.
All right. Thank you so much, April and Alan. Great overview. We do have a couple of questions, more than a couple of questions coming in, so let me get to it. Can you talk a little bit more about some of the specific successful QI projects you've done?
So is this for our health departments?
I think if the participant wants to clarify, my take is that I think it would be for specific health departments, and you might share that information with other health departments.
Okay, well, we have had several, and there's a couple that come to my mind. In Kentucky, I will be very honest, our accounting system and financial record management with the state health department, because we are a decentralized state, is a mess. And so we've had to do some things internally to make that mess a little better. And we have recently gone to different accounting systems, including laser check printing, and that has saved a lot of time with our payroll clerks. We also have a home health agency, and we noticed that we had high rehospitalization rates in our home health patients. So we purchased really large, specific medication management boxes, and we have seen that our rehospitalization rates have decreased because our patients aren't getting their medications mixed up or forgetting to take their medication at the right time. We also received NNPHI money for the Kaizen grant opportunity, and we restructured our internal network drive so that it is more user-friendly and effective, and we're getting ready to connect our reorganized internal drive with a new performance management system. So that's also another really successful quality improvement project that we've done, and I'd welcome Alan to share any coming from Northern Kentucky.
One project that I remember that we were very successful with is that we had a lot of influx of unlicensed food trucks coming to various locations throughout Northern Kentucky. And we were trying to come up with a process to work with them. We called it Operation Chuck Wagon, and it received some national attention with a video that we did. But by sitting down and going through a QI process, we came up with strategies to address the issue with getting food trucks licensed in Northern Kentucky. we had a lot of the issue because they came from across the river in Cincinnati, and they thought just because they were licensed on that side of the river, they could work on this side of the river, but it just doesn't work that way. So that was one of the exciting processes that QI processes that we completed.
Great. Somebody else is asking where they could find out more information about the Accreditation Jumpstart, what you were talking about.
We don't have any formal materials out, so you can contact myself or Alan, and we will be sure to include our counterparts, which include Dr. Carmen and Chrissy Rowland at Barren River and Janie Cameron at the State Health Department. So if you just get in touch with one of us, then we will be sure to include you on any information that we come out with.
Yeah, and you can always get that to us, and we can distribute it as well. Another question is, how did this really get started with your leadership? Did your leadership say, hey, go do this? Or was it more along the lines of you asked your leadership and showed them why it would be helpful to the whole department?
I think our leaders have been very supportive of the whole concept of accreditation, and also the concept that we're all kind of in this together, and anything that can help the local health department helps the whole community and helps the whole state and nation for that matter. So I think our leadership, I know my leadership in April's has been very supportive of us spending time like doing these kind of webinars and passing out whatever information that we have that could be useful to others. April, you want to jump in?
I would just add that as soon as Angie began working on this project, all the health departments that had an imminent interest in accreditation, their leadership was on board and supportive. And like I said, it's a 2-hour meeting once a month, so there's not that much commitment that they have to do, and it is very obvious. Anytime we were thinking about not having our annual retreat this year, and I sent a survey out to the group, and of all the respondents, all of them responded that it was valuable to have this meeting. And not all of them could come because of the location, but they all knew that, or they all responded that meeting together once a year face-to-face to plan our next year's activities was very valuable.
And I might point out that we've been holding these retreats in conjunction with the CATA retreats, which are attended by the health department directors. So it certainly gives an opportunity to travel together with your director for a couple of hours with a one-on-one audience, and that's always a plus.
Well said. A couple logistics. So you said that the work group really rotates who leads the meetings, but is there somebody who chairs the meetings or makes sure that these meetings happen, nudges the next person on the table?
Well, we found that rotating leadership has really been effective for our group. So, for instance, in October, we planned out who would host and facilitate the work group meetings for the rest of the year. And so each month, a local health department accreditation coordinator takes on, fulfills the standing agenda items, sends out reminders, will send out the meeting minutes. So it's really a grassroots type effort, and there hasn't ever been the need for one person to manage the group, because we kind of self-regulate. And then we've had some turnover as well, so it's worked out nicely that no one person was responsible for keeping it going and motivating others.
One other question came in around what strategies you may have for involving and engaging the health departments on the eastern or western edges of your state.
So when we planned this year's meetings, we did something different than we ever had before, and that was we will rotate locations of the meetings so that they flip-flop of going in a central location in the state, an eastern location in the state, and a western location in the state. And at the same time, we will still offer the ITV for every meeting. So on the face-to-face meetings, we will be alternating sites so that we can get more participation and involve those health departments on the eastern and western edges.
Thank you.
And also the retreats, as I mentioned earlier, we have state resort parks all around the state, and every year we hold the annual retreat at a different resort park. Sometimes it's in the north, sometimes the south, east. Our last one was in Kentucky Dam Village, which is way out in the western part by the Penny Ryle district out in the west on the map that's up. And so that's very good for especially the two-day retreat. And usually people can drive a pretty good distance if you're going to spend the night.
Mm-hmm. Next question. Do you think your group could have applied for PHAB accreditation as an integrated public health agency or as a whole state program? Was there any other way to apply for accreditation besides each local health department or district health department applying individually that you know of?
From my understanding, since we are a decentralized state, any health department that wants to achieve accreditation status will need to submit independently. So every district or individual county health department will have to go through the process.
There may be some possibility that some of the smaller county health departments can go together if they share a substantial amount of services. That really hasn't been discussed as a topic, but that's within the realm of possibility. But yeah, as April said, we are decentralized, and unlike Florida, which is we have our paychecks come from our local district and our local health departments, and not from the state.
I see. This next question is asking if you work with any national groups, like the Public Health Foundation or the Center for Public Health Quality or any others for your work.
We have, myself and Alan and several of the other accreditation coordinators in Kentucky have been very involved in the NACCHO Accreditation Coordinators Learning Community, which you can be a part of when your application is accepted through PHAB. And that has been a really good tool, and we've been able to, when we have had face-to-face meetings in the past, our Kentucky group can emulate what we learned in the larger national group with activities and things like the NACCHO Roadmap to QI. So we have been involved with NACCHO in regards to the Accreditation Coordinator Learning Community.
And also the NACCHO MAP work group, which of course focuses on the prerequisites like doing your CHA and your CHIP. So that's very closely associated.
This next question is a good question, but very complicated, and we could spend a lot of time on it. But do want to ask you, because I know that you've had a lot of strength in your health departments around this, and the question is, how do some of the public health department directors support the accreditation processes? Like, what are the specific things that they do to show their support and really support your efforts?
I think communicating to their staff, to the communities that they serve, and to the Board of Health or their governing entity, and doing education with those three groups of people about what accreditation is, the benefits of accreditation, and what our health department's accreditation process may look like. So for an independent county, it might look different than Three Rivers or Northern Kentucky. I think you just have to communicate to all of your stakeholders its importance. I can get very specific and say that my director, Dr. Georgia Heiss, participated in every single accreditation team meeting. She has accreditation as a standing agenda item for our management team meetings, for our Board of Health meetings. She attended our community partnership meetings to talk about the accreditation process and to support them. So those are some specific things that she has done, but really being a champion, not just at Three Rivers, but across the state and nationally, that accreditation is the way to go. It's not just a stamp of approval. It's how health departments should be running their infrastructure.
April, how did she get so educated on it? We all know how involved Georgia is, but she knows so much about it and some other, I know it must be tough balancing those priorities. So do you know what resources she looked to learn more about it so she could talk on it? Was it you?
I don't know. Well, I think she has her doctorate in public health from the University of Kentucky, so she has had mentors like Dr. Scutchfield, who is on the PHAB Board of Directors, educate her on the importance of accreditation. But really she looks at Kentucky's really poor health outcomes, like Alan mentioned, and knows that there's no way to go but up, and accreditation is the way that can strengthen your communities and your staff and your Board of Health. And so she looked at the standards and measures and knew that it could be done. And I'm not exactly sure how she got so abreast in the accreditation world.
As I had mentioned early on in the conversation this afternoon, we've been looking at accreditation ever since the Exploring Accreditation report came out in 2006. So a lot of us have been involved on various work groups for PHAB. As April said, a lot of us are site visitors for PHAB. We're involved in the alpha and beta tests, so we've been involved a whole lot. And I think we've all just kind of learned on the fly, including PHAB. You know, they use their various committees to learn what they were doing. So this has been a process of learning from each other, not just us learning from PHAB, but vice versa. So I know I was involved on the process committee with PHAB and spent just a lot of time talking about what does an accreditation process look like? What are the steps that you need to go through? What are the pitfalls of accreditation? And so we bring those conversations back to the table when we get together and meet and talk about the various things that are going on. So the process is very widely spread out. To different conferences, that's a big part also, going to like the NACCHO conference and APHA conference and NPHI's conference. All of those are important to get the bigger picture of what's going on.
Mm-hmm. And Alan, you mentioned becoming a site visitor. I know that PHAB is always recruiting site visitors, so you can find out more information on their website or email Jeff Lake at PHAB, and I can type in his email if you are interested in getting more information about what it takes to become a site visitor. Next question is, to what degree do your boards of health, have they been involved in your processes?
Well, for one thing, they needed to be involved in the process because that's part of the site visit, is that the site visitors will meet with the Board of Health. So we've been keeping our Board of Health very involved with what's going on in public health, and at every meeting there's an update of what we're doing towards accreditation, or at this point reaccreditation. So we've been very involved with keeping our Board of Health informed with what's going on, and they've been supportive as far as giving us the go-ahead to do it, and supporting us and supporting our director.
And this is April. I would just add that, like I said, we have it as a standing agenda item for all of our meetings. So when we began the process, they were informed of where we were, and every time they came together and met, they were continuously educated about what was going on with our process and how they could be involved. And of course they participated in our site visit process, but because they were more aware of what was going on with accreditation, they were also a lot more engaged with our community health assessment the past time that we facilitated that. And then they've also been interviewed by PHAB to speak out about the benefits of accreditation. And so they've really been champions in our communities to relay the message of how important accreditation is for local health departments.
Great. I have a specific question, and that is, for the health departments that are pursuing accreditation, have any retail food regulatory programs in Kentucky made use of the NACCHO crosswalk between the accreditation and the voluntary National Retail Food Regulatory Program Standards, if you know anything about that specific work?
I do know of the crosswalk, but I have not taken the time yet to look over it. I remember forwarding the email to our environmental health manager. So to be honest, it's not something that I've delved into yet. We're still trying to celebrate the accreditation status.
Yeah, I'm in about the same place as April. I'm familiar with it. I passed it on to our environmental director, and I don't know if any action's been taken like at the state level. Our environmental programs are very closely regulated at the state level. So it really would be more coming from our state health department than local health departments moving it up the ladder, so to speak. I don't know if that answers your question.
I think it does a really good job of trying to do so. Definitely. And just a final question for you both is, throughout this work over the last few years at least, what would be your main tip for people who are interested in starting up a work group in their state? The biggest thing that you could offer?
I would just say call up all your associates that you work with and say, hey, let's get together and have lunch, and go from there.
I would say think about the big picture. It's really easy to get caught up in what is my health department doing and what can I bring to the table. But think about how if your state is moving forward with accreditation, whether it's your health department or your neighboring health department, what great things that brings for your state overall, not just for your health department or for the health department next to you. So even if there's something going on in a meeting that might not directly affect your health department, maybe you've already mastered QI and it's a presentation you've heard 2 or 3 times before, just being there and supporting it, because everybody's going to bring different things to the table. So just trying to be a partner in it with your neighboring health departments and think about the big picture of advancing accreditation.
With that, I want to thank you both immensely. You are just another testimony of how much you share within your state and on the national level. So thank you so much for sharing what you do, low resource, low cost ways of improving the health throughout the whole state and further. So thank you so much, everyone, and have a good day. Bye-bye.